foremost, we want to continue to advocate for our profession, to become recognized as a formal healthcare provider. What it affords us is the ability to have the resources to provide more of this care for our patients. I think when I work with the residents and the students that come through our programs, I think what is so key is to align yourselves with a skill set that makes you very adaptable, because these therapies are coming out so rapidly that you aren't always going to be on top of every single novel therapy that's coming out. Specifically for a lot of institutions where, let's just say you even have a bit of a focus for a pharmacist and they focus in hematology. Well, hematology is a very broad scope. We're talking just here today about CLL. Imagine all the other malignancies that have all these new novel therapies that are coming out. So I think sometimes, and I've learned this over my career so far, is that we, as much as you push yourself to keep updated and to know what is relevant, I think the other important thing, especially as a resident, is to build that skill set of how you adapt, how you deal with questions that you may have never heard before, whether it's coming from the patient, because our patients are very well educated in their diseases and the treatment options available, and it's often the patients that are asking, I hear this drug is coming out, it's going to be approved soon, when will it be available? To the healthcare providers, and really being a efficient and effective resource for them, because as we all know now, just as we're trying to get a handle on all of these therapies, they as well are trying to keep updated on all of these things, as well as manage the patients that they're taking care of. So I think just being adaptable, having that skill set to really be able to apply knowledge, but then also know how to reach out and get the knowledge or the information that you need that you might not have right at that moment when you're asked a question.